Hello, my name is Latrice Means, nurse educator here at Children's of Alabama, and I want to talk to you today about our steps to improve early recognition and treatment of sepsis. Sepsis is one of the leading causes of childhood death when it is not identified and treated quickly. Our goal at Children's is to help our staff recognize, communicate, and treat sepsis rapidly to improve our patients' outcomes.
Hey Tommy, how are you feeling today?
Well, we were kind of up all night. He's just been complaining that his belly hurts.
Okay. Tommy, can you show me where it hurts?
It hurts right here.
Yeah. He's mostly been complaining down here on the bottom.
Okay. I'm gonna listen to you really quick, okay?
Okay.
The sepsis screening tool should be completed with each set of vital signs. The screening tool helps you identify patients on the sepsis red or yellow pathway. A sepsis huddle is a team huddle to review clinical findings and determine if a patient is on the sepsis pathway. A sepsis huddle includes the bedside nurse, the charge nurse, and a prescriber. The huddle starts with a quick recap of the patient's assessment and the nurse's concern with the charge nurse. If it is determined that the patient is triggering either a sepsis yellow or a sepsis red, then it is communicated with the prescriber.
Hey Dr. Godwin, it's Kaylin. I'm calling about Tommy Johnson in 314. Tommy is here for fever, abdominal pain, and nausea. He's complaining of lower right abdominal pain, which is tender to the touch. His respiratory rate is 48 and his temperature is 101.8. His blood pressure is 101/60 and his heart rate is 128. The patient meets our sepsis yellow criteria. Will you come and assess him within the next 20 minutes? Per protocol, I have put him on continuous oximetry. I'm getting vital signs every 15 minutes and administered PRN Tylenol. He does not meet chat criteria.
The huddle is communicated using SBAR format. SBAR stands for situation, background, assessment, and recommendation. This communication tool helps provide information in a consistent manner.
Thanks for coming up, Dr. Godwin. I think you talked to Caitlin on the phone.
Yes.
Okay. What do you think?
So I agree with y'all. I think
Okay.
I think being on the sepsis yellow protocol is appropriate right now. We just need to update Mom on what else we're going to do.
Yeah.
Hey, Tommy. Assume your mom.
Yeah, I'm on.
Dr. Godwin.
Okay, nice to meet you.
You're the doctor helping take care of Tommy today. I know you've already met the nurse. I'm going to take a quick look at him since I haven't listened to him yet, and then we'll
Okay.
kind of talk about what we think's going on and what we're going to do.
Okay.
Is that okay?
Yeah, that's okay.
Hey, Tommy. So we think he might have an infection right now,
Okay.
somewhere in his body. So what we're doing is stuff that's trying to figure out where the infection's coming from.
Okay.
So because of his vital signs, what they look like, and some other objective lab measures we've seen so far, he's kind of triggered what we call a sepsis yellow protocol at the hospital.
Okay.
And because of that, that's why the nurse went in and put oxygen on him, and she put the O2 sat on his finger so we keep a track of how well he's breathing. And that means what we're going to do next is we're going to give him a little fluid bolus and continue some fluids. We're going to start some antibiotics, and we're going to get some more lab work done.
Okay.
Do you have questions about anything?
I don't think so.
Prescriber responsibilities include assessing the patient within the allotted time frame, and utilizing the sepsis order sets when placing orders. The Sepsis Supportive Care Order Set is easily found by typing sepsis into the order prompt. In the sepsis order, the prescriber has the option to select orders for either sepsis red or sepsis yellow pathway. Patients triggering sepsis red are more critical. It is essential these patients receive prompt response and treatment. Patients triggering the sepsis red will likely require transfer to a higher level of care. By utilizing our sepsis screening tools, performing a sepsis huddle, following our sepsis pathways, and using our sepsis order sets, we believe we can decrease our sepsis events and improve our patient outcomes here at Children's of Alabama. Thank you.